third exercise that I've chosen for my client to start with is the hip hinge. Now we're going to be using a broomstick to keep the upper body in straight alignment. So this is just a very basic movement so that we can do more complex movements in the future. So if we can learn a basic hip hinge, which is keeping the 3 points of contact, the tailbone, the spine in between the shoulder blades, and then the back of the head. So this is a good alignment, and that broom should be completely vertical. All right, that is a line of gravity posterior to the spine. So if I can keep that as I hinge at the hip, all right, I am loading my hamstrings and my gluteus maximus and medius. All right, those are the prime muscles that we are going to focus on stretching. They're holding the load, and then they will also be responsible for bringing us back upright. So the knees will be soft, and we're going to again focus primarily semimembranosus, tendinosis, and then the biceps femoris on the outside hamstring group, gluteus maximus, and then the medius. Those are the primary muscles. The stabilizers will be your core, your abdominals, transverse abdominis, the obliques, and then the erector spinae group running up the spine, because we do not want the upper body to move at all. It's just hinging at the hip. As far as the phases of movement go, the preparatory phase is when we are engaging the core and flattening our back out against the broomstick. The eccentric phase, in this case, happens first. That's when we are loading the glutes and the hamstrings, and then the concentric phase is when we would be pushing back up. So breathing in all the way down, and breathing out on the way back up. Now, we can go a lot of directions once the hip hinge is learned. For example, I can do a straight leg deadlift, where I come down here into this position. I could hold on to a barbell or a couple of dumbbells and straight and back up. We can teach a squat, which again we want to keep this good alignment. We start with the hips back, and then we use our knees. And once we start bending our knees, then the quadriceps become a primary muscle group as well. So the squat and the deadlift variations will be taught after the hip hinge is mastered. So this is one of the ways I found to be quite effective in teaching a proper hip hinge. So the palpation for the hip hinge, mainly we're going to target the gluteus maximus, right? Because that's one of the largest muscle in the body, and if we can engage it properly, a lot of folks cannot engage it. So when my client is ideally in a staggered stance, hinging at the hip, we want the gluteus maximus to be engaged and holding the upper body steady as she's doing her work out in front of her. So anytime that we are working over top of a surface, if you are a cook and you have the countertop and you're doing this all day, and if you let your shoulders and head drop, then that puts a lot of pressure on the back. And the back is carrying the load versus the glutes. If we can straighten the back out and push the butt back a little bit more, hip hinge at the hip and load the glutes. So a staggered stance helps that, but we still want to be able to hinge at the hip. All right, and again, one more time with the broomstick as our reference for what a straight back feels like and looks like. I can hinge in a staggered stance with either foot forward, and if we learn that hip hinge, it goes a long way into teaching other lower body exercises. Now for a couple of common mistakes when conducting a hip hinge. So the hip hinge is done whenever somebody is doing a squat or a deadlift, and one of the things I'm seeing a lot lately, and I didn't notice it before, was somebody lifting their head in either of those exercises and not keeping it neutral. All right? So if we were to get down into a basically where you would start a deadlift exercises, the knees are soft and most of the movement is coming from the hips, so my spine is straight. Now if I was to lift my head, see how far that broom comes off of my spine, so the line of gravity for that upper body is compromised. So I'm compromising the integrity of the spine. So that's one of the main things that I see lately. So in a squat or deadlift, you want to keep the head neutral and not raise it up. Okay. Another thing is the lumbar spine. So we want to engage the core, kind of flatten out that lower back to that broomstick, so we do not have an excessive lordotic curve. I shouldn't have too much space here, all right? Because I can stick my butt out and still keep that point of contact on the tailbone, the shoulder blades, and the back of the head. But if it's excessive, then I'm going to have issues trying to get into my hip hinge, and I'm not engaging. I can let the core sag and keep those 3 points, but I want to contract, keep this flat against that broomstick as best as I can during the hinge. So those are the two main mistakes that I see. So I demonstrated the hip hinge to my client, and now she's going to try it herself. So go ahead and get in position, the broomstick down the back. So we're going to stand tall, stomach is in tight to flatten that lumbar region against the pole. So we got the tailbone, middle of the back, and the head. All right, so the knees are going to be soft, and I'm going to be palpating the glutes. I've already asked her permission to do that. I'll go ahead and perform your first repetition slowly. Good. Breathing in on the way down, breathing out on the way back up. Knees are soft. Excellent. Good. So pause at the top if you need to rest for any reason. Loading the glutes and the hamstrings here. That's where you should feel the stretch, and then pulling back up from. The shoulders are coming away. Contract back. Good. Keep them tight and hinge. 6, 7, 8, hands looking good, tight, 9, and we need a little bit more, load, and 10. Excellent. So, looks like you picked up on that very well. The client has excellent hamstring flexibility and definitely did a good job demonstrating the hip hinge. In fact, I think she's ready to go on to more complex movements such as a bodyweight squat or maybe some straight leg deadlifts at this point, because she proved to be able to do that pretty well. So almost a grade of an A, not quite, just a little bit more practice, and then I think she'll be ready to go.